will call the Board of Health meeting for the February 16th to order and certify that the open meeting law requirements have been met. Number 3 on the agenda is a public comment period. So I'll open up now for anyone from the public that would want to speak. And could somebody refresh my memory what the phone number is?
715-538-1770.
Thank you, Sally.
Was that 1770?
I'll ask again for a second time if there's anyone out in the public that would like to speak, to call in to 715-538-1770. I did get a call last Thursday from one of the persons in my district, and I believe this person is going to be writing a letter to the health department as a thank you. But we talked for a little while about what an awesome job the health department is doing. And I said I would relay that message at the meeting tonight. So thank you from one of my constituents.
We appreciate hearing that. Thank you.
And this will be the third and final call. If anyone from the public wants to make a comment, call 715-538-1770. Hearing no phones ringing, I'll close the public comment period. According to my computer, it's like 6:03. Item number 4 is approving the agenda. So we need a motion to approve the agenda, which consists of 15 items.
Joe Feltus, so moved. Second.
So is that Johnson that made the second?
Yes.
So motion made by Feltus and Johnson to approve the agenda. All those in favor say aye.
Aye.
Aye. Opposed? We have approved the agenda. Then we received by email the January Board of Health minutes. Again, we need someone to make a motion.
Bert Hodis
has joined the meeting.
Anyone want to make a motion to approve the minutes for January?
Joe Feltus, so moved.
In a second. Thank you. So we have a motion by Feltus and Nimitz to approve the January minutes. Any discussion on that? All those in favor say aye.
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 Anyone opposed? Minutes have been approved. Number 6 looks like a sad item. Approval of a WIC staff resignation.
Yes, that is a sad item. I've been informed by Alma Rivera that she will be leaving us. She's going to be working remote for a short time until we can get her replacement on board. The reason for her move was not that she hates us, but that her husband had an opportunity elsewhere, which is too far to commute. So we will miss Alma.
I'll make a motion to accept the resignation of Alma.
Second.
Ooh. So we have a motion by Baxter and second by Johnson, I believe, to accept the resignation of Alma as in our WIC department. Do we need to vote? All those in favor say aye.
Aye.
Aye. Opposed? Will someone be writing a letter to thank Alma for all of her services?
I would be happy to do that.
Thank you very much. Oh, go ahead. So item number 6 or 7 is the approval of the WIC merger with Buffalo County and the Buffalo County administration.
Okay, I've asked Kayla Bear to be here today. This is a project that she has been working hard on and has been evolving over the last couple of years. So I'm going to turn the floor over to her. Thank you, Kayla.
All right, can everyone hear me okay, including people virtually? Okay, great. Yes, so we have Melissa Dunlap with us. She's the WIC regional consultant for the Western region at the state level. And then we also have Dave Reidners as well. He is the Buffalo County Health and Human Services Director. So I asked them to be here to help answer any questions you guys may have, since I've been working with them pretty closely through this process. So you all received the proposal for the Trempealeau County WIC expansion to Buffalo County. So I just wanted to provide a brief summary. I'm not going to read through the entire document since you all have received it in advance. Basically, the background for this initial project was due to decreasing caseloads across the entire state and country for WIC participation. Our funding is directly impacted by the number of participants served, and as you can see from the table, we have been decreasing over the past 10 years with our average monthly participation. Unfortunately, with a decline in funding and participation, administration burden still remains the same. So we're expected to maintain adequate and equal services with less funds. So in order to decrease the use for tax levy, have better staff retention, and increase funding, merging WIC projects in the region is a positive way to work on this issue. So currently, Trempealeau County WIC has been operating with 4 clinic locations in Trempealeau County. Permanent staff includes a full-time dietitian/director, that's my position, and a 60% FTE WIC technician, which would have been Alma. So we'll be looking for a new one there. And then additionally, we contracted with the Buffalo County WIC director dietitian to assist with 4 to 5 of the 8 to 10 clinic days each month. Buffalo County has 2 clinic locations in Buffalo County with permanent staff being a full-time WIC director or dietitian and a 20% FTE WIC technician. Something to point out is that Trempealeau County's WIC program is fully funded by the Wisconsin State WIC Program's annual grant allocation and does not utilize Trempealeau County tax levy. Buffalo County's program does require tax levy at this time. So some of the specific advantages to this merge would be increasing our caseload and funding to expand the program. There's also a clinic site in Mondovi, so this would provide additional opportunities for WIC participants in the northern region of the county. There would be less administrative burden, which would lead to better customer service and WIC participant retention. We can spend more time on counseling, spend more time on outreach with other community programs in the area. Focus on our vendor relationships to improve the shopping experience for WIC participants, encourage people to stay in the program. And less time spent billing back and forth between the counties with our current partnership. Carol spends a lot of time doing that right now, I know, as do I with putting together those invoices, and Buffalo County does as well. So another advantage would be greater staff retention. We'd have more clinic coverage. That's 8 to 10 clinics a month is a lot for one dietitian to handle alone. So there'd be less burnout and ability to cover for any sick time, vacation time, or maternity leave, which tends to happen when you hire young females. Opportunities to recruit and retain qualified full-time staff rather than part-time staff that can be more difficult to retain for a longer period of time, which can lead to more training. Additionally, we become a leader in regionalizing WIC programs with the potential to expand to other counties rather than being absorbed. There's very few WIC programs who have done this regionalization effort, so we would be a leader in the state for moving forward with this. For a quick fiscal summary, the 2021 estimated grant allocation, we don't have this final number yet, for Trempealeau County alone would be $159,105. If we were a merged product, so Buffalo and Trempealeau combined, the estimated grant allocation would be $216,390. The budget would be, for a merged project, again, Buffalo and Trempealeau County, $169,543, which leaves a surplus of just almost $47,000. That budget would include the WIC director, a project nutritionist, which would be a new staff member, which is on the agenda later tonight, the public health technician, and then operations, cell phones, supplies, rent for clinic sites, all the kind of operations that we need to keep the program running. So that surplus is very helpful because it can help with nutrition education supplies, additional trainings to stay current on nutrition topics. It can also allow for growth of the program and increases staff retention, knowing that there is opportunities to take the insurance and with our stepwise salary increases and cost of living increases that come annually. So I specifically in this summary included MOU language that I wanted to make sure we talk about tonight. So I'll just read this right from the page here. Trempealeau County assumes all financial responsibility for providing WIC services to Buffalo County residents using the funds received through the state WIC grant. At the end of the fiscal year, if the WIC grant allocation does not cover all expenses, the deficit will be shared between the two counties based on the participant count ratio per county. Participation will be broken down monthly by county and then averaged to determine the split of the expenses not covered by the WIC grant allocation. There's also additional language in the MOU stating that this would, of course, need to be approved by the county board. But this is something we, from the beginning, wanted to make sure we were clear on with both counties, that if we were to exceed the grant allocation from the state WIC office, that it would be shared among both counties. Before I move on to the MOU changes, are there any questions? Yes.
Kayla, just a couple notes on the proposal. First of all, I'll be for the merger. So we're not drowning at this time with COVID, so I'll be for the merger, Barb. Just some questions that may be answered. On the first page, it says the caseload continues to decrease due to fewer births. Are there any other reasons than fewer births? Because right now, I know there's schools that are considering building programs. Our Arcadia Catholic School just got done building a program. Independence is close if we continue to get the elementary kids. So there's got to be a reason just besides fewer births. And I know I'm just talking locally, but you can probably expand on it regionally and or nationally. Why is the caseload going down?
I think that part of the challenge has been the outreach. It's been difficult to build those relationships in this position, particularly with the high turnover in this position. Prior to me, I believe there were 3 other dietitians in a matter of 4 years. So that was difficult. Now I feel like I do have very good partnerships in the community, which is great. So I think that has been a problem. And like I said, with the decrease in the funding, your administrative burden is still the same.
Correct.
So you have less time for that outreach, which makes it more difficult to gather more participants and so on.
Is that true in other regions, say like Eau Claire, La Crosse, Milwaukee too, that there's a turnover of staff all the time, that you don't get the outreach, or is it just in the rural areas?
That's a good question. And Melissa, I don't know if you can answer that at all.
I think it's county specific. We don't tend to have a lot of turnover in the WIC program in the more metro areas or in the larger agencies. People tend to stay statewide. But the declining birth rates is definitely a contributing factor statewide and regionally and nationally.
Okay,
Yeah.
page 2.
Yes.
I know it doesn't increase local tax levy, but there's still funding, and it's still tax dollars, be it state or national. So it is still something that we don't want to increase just for the sake of increasing, because it's not because of local tax levy. It's still tax dollars being utilized. So I want that. And then I know I may sound backwards, but it's like, okay, isn't it good that we don't have as much participation? Isn't it, it's like, I know it says we outreach to increase participation, but in reality, isn't that good that we don't have as much participation?
Yeah, so that's a really good point. So it is good. I mean, the ultimate goal, right, is that no one has to be on WIC. That's ultimately what we would love to see. But we do know that there are a lot of people who are eligible who are not participating, not receiving these services, which are so crucial to their children's beginning of life. Nutrition is very critical. And so we want to make sure that we are reaching everybody who's eligible in the area. And that's really what the struggle can be, is to reach those estimated eligible people. That's where the outreach comes in, to make sure we're getting all of those groups in and getting the WIC services as they need it. In terms of your other point about not increasing the budget just because we can, so this partnership this merge would actually help us to be more efficient and more fiscally responsible with the grant dollars. Instead of duplicating services across 2 counties in which we're both doing the same thing, it can easily be done by one person because we're both smaller agencies. And so instead of both of us doing it, both of us putting in the time for it, it gets condensed into one position. So that actually really helps to reduce the overall cost, I would say.
And that's the main reason why I would vote for it, is that it would lessen the redundancy of the administration and the bookkeeping, and that is just, I'm just happy that there's not as much increased participation, because that's usually good. Okay, that's all.
Okay.
I just would like to point out is that from just hearsay in the community, we have a lot of children that would definitely benefit by being in a WIC program. And part of the issue is a lot of people don't know what's available, and part of increasing the outreach is to help get more word out there so that they know what's available and can participate in programs that their children so desperately need.
I have a question about the funding. If Buffalo County has to tax levy to fund and we don't, when it comes to the end of the year, I guess I'm wondering why is it a split equally? You know, when have had to put tax money in there and we haven't.
You mean like if we were to go over the grant allocation? So it wouldn't be split evenly. It would be based on participation. Is that what you're asking about? No. Okay.
I guess, say they have to put in $50,000 to fund the program, the local tax levy. And at the end of the year, we're over. And then we divide it equally. Wouldn't they have to kick that money that they normally kick in? Why should we absorb their tax dollars?
Gotcha. So, hopefully I'm going to answer this right. And Dave and Barb, if I don't, please jump in. But, so Buffalo County has indirect and AMSO as part of their budget, and we do not in the WIC grant. So that's one of the major differences in our budgets. And so by merging, those costs would be eliminated. And we wouldn't need that indirect or AMSO anymore from Buffalo County. That's all defined in the MOU as well, that they would provide the space, printer, IT services as needed kind of a thing. Does that help answer your question? Okay. Otherwise, Barb, do you have anything to add?
Yeah, I'll put it also that we're going to be picking up efficiencies in terms of paperwork and reports and things like that. And that itself will help reduce costs. So at this point in time, based upon current calculations, it does not look like there's going to be any tax levy required from either county.
Kayla, on page 3,
Yes.
the proposal, it says, note, while this grant allocation does not include the peer breastfeeding counselor program, farmers market nutrition program, or fit families funding, Trempealeau County will also assume all responsibilities and funding for these WIC-associated programs. How does that work? Are you going to, I would assume you're not going to say participants in Buffalo County, oh, we can't talk about these programs or we can't help with the farmers market. So it does assume that Trempealeau County will pay for Buffalo County residents getting this part of WIC.
So each of these programs have their own separate funding, and so we would be responsible for the Buffalo County funding as well. So we would get that grant allocation that Buffalo County currently gets. We would get that then, and be able to continue to provide those services in those areas. They're just each a separate grant allocation, not included in the overall WIC grant allocation.
Okay, good. That's all.
Okay. Any other questions about the proposal?
This is Sally. I have a question. Has this gone by Corp Council?
I don't know if Corp Council has seen this proposal, I guess, but he has reviewed the MOU, and I have some updates from him as of 5:30 that I wanted to share with you guys from the MOU. So I can go ahead and share that, Sally, if that's all right?
Please do.
Okay.
Yeah.
So with the MOU, you guys all received a draft of that as well. So section 2, there was some changes here, so I'm going to read. So section 2 had some changes, and section 6 was moved up to section 2. So we would remove section 2, which is we would remove section 6, which is terms, and put it in section 2, which is MOU term. So instead of having 2 term sections, it would all be together. So the new one from Rick says, this agreement becomes effective when signed by authorized Trempealeau County and Buffalo County representatives. This agreement may be amended in writing at any time by mutual consent of the parties. Amendments will be written and signed by the proper representatives of each party and shall identify the exact nature of the amendments. Any amendments will be attached as amendments or as clarifications to this agreement. Either party may terminate its participation in this agreement by providing a 90-day notice in writing to all other parties prior to the end of the agreement period. The termination would be effective at the end of the 90-day period. The agreement shall be annually reviewed by authorized Trempealeau County and Buffalo County representatives and revised upon the mutual concurrence of the parties. Any questions about those changes? Okay. So the second addition was in section 3G. We added, there was that highlighted portion about the Buffalo County supplies, so we added any Buffalo County WIC supplies purchased up to the time of the execution of this agreement can be used for WIC purposes under this agreement. And then section 4D, I had a highlighted area about IT services. So for any IT services or equipment provided by Buffalo County, the Buffalo County IT department will provide ongoing maintenance and troubleshooting assistance for such equipment and services. Any questions about those additions?
One change.
Yes.
In 4E, Buffalo County will provide toys and education material in the waiting room,
Yes.
not during COVID.
No, no,
Okay,
definitely not.
all right,
WIC is still all remote during COVID.
very good. And Buffalo County staff will provide outreach. Is there any definition of what that means, outreach? Is it once a year, or is it going to be ongoing? Or is there any definition that needs to be added to that?
That is a good question. I believe the intent of this statement was to ensure that the Buffalo County Health and Human Services staff will continue to refer their patients to the WIC program. Just because it's run by Trempealeau County doesn't mean that program doesn't still exist. So Dave, can you give any guidance into how that process currently happens in your county?
Well, we have a Facebook page with our department, for example, and, ability to do, other marketing and, when we're doing presentations or we're participated in health fairs or school fairs, and we have a presence there, the county fair. Those are all opportunities to promote WIC. And so the way we look at it is we will be supporting this program along with the other things that we're directly doing. Those are just some examples.
Mm-hmm. So maybe clarifying that staff will provide outreach along with other health and human services programs, so it's concurrent with those. Yeah. Thank you. Any other questions or suggestions with the MOU?
This is Sally again. In section 3, we're down to F, looking at an advisory committee. Is this going to be a newly formed committee?
Yes, but I don't think it was supposed to be like a... Barb, was this intended to be like an official committee? Maybe we shouldn't say committee.
It was my understanding that those of us who are involved in the management are kind of look it over every year, make sure everything seems to be going the right way, or as needed, anytime we have a question, basically to consult each other as opposed to make unilateral decisions.
Sally,
So
would
this
you...
wouldn't be another county committee with county board members or electeds on it. This would be those who are working within the program.
Right. Would you suggest we change that to maybe group instead of committee?
Well, just as county board members, the word committee gives us terrors. So,
Yep.
Yeah, I find a different word maybe just so that it is clear to everybody reading it and doesn't create any hiccups when it has to go to the full board.
Okay, thank you. Any other comments or questions about the MOU?
What did you find out? This is Beth. What did you find out about the term? Because this was only for 6 months.
Yes, so I asked Melissa to be here tonight to talk about the term from the state perspective, but I'll just provide a perspective locally. So we don't anticipate having any issues because this partnership has been 2 years in the making already. And so we don't have any reason to believe this will not go well. We think this will go very well. It has been going well for 2 years. So that was the reason for no end date. And then we added, or we have that language in there about terminating with that 90-day notice. And then Melissa, if you want to speak to the state perspective on this, that would be helpful.
Yeah, just to add to what Kayla was saying, a lot of time and effort has gone into, making sure this is a good fit and that this will be a smooth transition. I know Barb and Dave and Kayla and April have all worked on this. And from a state standpoint, it does take a significant amount of changes in our systems to merge two agencies. So I didn't want to give the impression that it was temporary. Like when you do merge, it's your merged agency, just based on all the work it takes to do that. So I think that's where the language had to be really clear.
Thank you.
As Kayla pointed out, this is the how do you say, procedures involved in this have been developing and being refined over the last couple of years. The big thing being us billing each other for the services that we provide. So most of the bugs, in fact, I would venture to say all of the bugs are pretty much worked out of it, and this is more just formalizing the process that we've already been doing.
Are there any other questions or suggestions for the MOU?
I know that in the past, the other agreement, and I keep scanning looking for it, and somebody just referenced the termination with 90 days. Is that in there, or are we referring to a previous version?
It is in there. So in the copy you have, Sally, it's section 6. And that is going to be moved up to section 2. So that way there's just the one term section. But it is in there.
Okay, thank you.
Okay. I also wanted to just give Dave a chance to tell you all about Buffalo County's perspective on this and where they're at with the process.
Well, thanks, Kayla. And for Buffalo County, and I'm speaking for myself and also for our Health and Human Services Committee, there's strong support for being able to go in this direction for all of the reasons that Kayla identified. And it does save taxpayer dollars to merge like this. And that's, when you have a situation where we've had the working relationship for 2 years, and we just have just a lot of respect and confidence in Trempealeau County and the quality of the services that have been provided over the 2 years and our ability to work together and kind of work out these details. So I'm excited for this future stability for the WIC customers of Buffalo County and with Trempealeau County, because it's just strengthens the position to be able to provide this for the years to come. And it's just really just pleased that we're at this point being able to talk about this. And I know my committee is real excited about the opportunity to work with Trempealeau in partnership like this. And any questions for me, please ask away.
How does your board feel about it?
They're unanimous and passionate in their support. In fact, we discussed this in December 1st. The committee took action. Our full county board is also very aware and on board of this direction too. See, for Buffalo, we've had some experiences with mergers in the past, and we've had some real good experience with that. Our Aging and Disability Resource Center now we're about 11 years into the merger, and it's just something that we really celebrate. Some of us have been involved since the beginning with that process, and we see each year in the merger, those efficiencies just strengthen as far as being able to, know the community and figure out how to get the administrative costs down to be able to get things done working as a two-county system. And so there's a lot of confidence about going in this direction. And plus, we've seen some really good results so far in the 2 years that we've been able to work together in the level that we've worked together. Having the depth of having two dietitians, that's been really good, because sometimes you need to have that coverage back and forth. And that's a real strength of this model.
Thank you.
Is there any other discussion? Because if there isn't any, we could have a motion to approve the MOU with the minor changes that have been discussed.
I'll make a motion to approve the WIC merger with Buffalo County.
I'll second that.
So Baxa and Johnson have made the motion to approve the WIC merger with Buffalo County. Any other discussion? I just want to say, I think a lot of work has been done on this already, and I really appreciate all the work that everyone has done. Makes perfect sense to me.
Thank you, Beth, and thank you all for your support.
All those in favor of approving the WIC merger with Buffalo County, say aye.
Aye.
Opposed? The approval has been granted. Closed session number 8. We need someone to read the statute when they're making the motion to move into closed session.
I'll make a motion to go into closed session pursuant to Wisconsin Statute Section 19.85, Paren 1, Paren C, to consider employment promotion, compensation, or performance evaluation data for employees in the health department.
And if someone second that,
I'll second it.
okay. Now,
Has left the meeting.
we need a roll call vote, so Killian will vote yes.
Johnson, yes.
Feltus, yes.
Nimitz, yes.
Miller, yes.
Okay. Good night.
Good night.
Thank you, folks, for coming.
Yeah, good night. Thank you for coming.
Thank you.
Then on the agenda item, we're on number 10, discussion and action on items that we discussed in closed session. So do we want 2 separate motions or 1 motion to include both topics?
It was my understanding that there was going to be 2 separate motions.
Okay, so go for it.
I'll make a motion, we post and hire a position for Trempealeau County nutritionist.
Second. Yep.
So we have a motion by Feltus, seconded by
Baxa.
Baxa, thank you, to hire and post a position, I'm writing as I'm speaking, sorry, for Trempealeau County nutritionist. Would this be a WIC nutritionist? All those in favor or any discussion on that motion? Then all those in favor of hiring and posting a position for Trempealeau County nutrition, say aye.
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 Opposed? Okay, second item,
I make a motion to approve the discussion made in closed session regarding compensation for a health department employee.
I'll second.
so now we have a motion by Miller and Baxa to approve discussion in closed session about the Trempealeau County employee. Is that what you said, Sally?
Yeah, the specified public health employee.
Okay. Any discussion? All those in favor of the motion for approving that discussion, say aye.
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 Opposed? That motion has passed. I'm getting a lot of feedback now. Then we have a resolution on the merger with WIC with Buffalo County. Hopefully someone will read that aloud.
I can read it. Oh, can you hear me?
Yes, I can.
Merger of WIC programs in Trempealeau and Buffalo counties. Whereas the state of Wisconsin is strongly encouraging counties to form regional consortiums to administer the women, infant, and children programs as a way to reduce administrative time spent managing the program and to allow maximum resources to be used for program benefits and outreach. And whereas the WIC programs in Trempealeau and Buffalo counties have been sharing staff and program responsibilities for the last 2 years through memorandums of understanding, billing each other for staff time. Recently, Buffalo County has lost their program dietitian, nutritionist, and the responsibilities are now being covered by Trempealeau County staff through previous MOUs. Administration requirements are being executed separately for each county, doubling the administration time required for a merged county program. And whereas merging the two WIC programs will save time and expenses for invoicing payments, as Trempealeau County will be the financial manager of the two programs and their related grants, and all program staff will be employed by Trempealeau County. And whereas Buffalo County Department of Health and Human Services voted on December 1st, 2020 to support the merger and have verbally agreed to the roles and responsibilities shown in the merger MOU. And whereas the merger of the two programs will increase administrative efficiency and increase resources for client counseling services and community outreach. And whereas WIC participation has been declining and the grant funding is allowed based on the number of clients served by the program, and the merger will increase the number of clients and increase time allotment for recruitment of new clients. And whereas Trumpealeau County will be recognized as a regional leader in the WIC program, and whereas no additional county levy is required at this time. If levy is required due to a shortfall of grant funds in the future, the costs will be shared by both counties in proportion to the home county of the WIC recipients. Now, be it resolved that the Trempealeau County WIC program will merge with Buffalo County WIC program as shown in the MOU for merger. Trempealeau County will be the administrator for the combined program. This was introduced by Barb Barzak, Director Health Officer for the Trempealeau County Health Department and the Trempealeau County Board of Health.
Thank you. So we need a motion to approve this resolution.
Make the motion.
Second.
So I have, who made the motion? Nemitz? And Miller?
Johnson.
Okay, Johnson and Miller made the motion and second to approve this resolution. I think just a voice vote is good enough. Is that correct, Sally?
I think we probably need to do a voice.
A voice? Okay. Any discussion on the resolution? Then all those in favor of the merger of the WIC programs of Trempealeau and Buffalo County say aye.
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 Opposed? And that resolution has passed. So now Barb is up for item number 12, a review and update on the COVID status and department issues, testing, school update, and vaccine distribution.
Okay, our COVID status is improving greatly. This morning, there was actually no new cases when we walked in the door. I believe there was only 14 over the weekend. And it's getting better. It's nowhere near what it was before. As far as testing, the number of people showing up at the National Guard testing events that we have is continuing to go down. The last one, which was last Friday, only had 13 people show up. We do have one scheduled with the Guard on the last Friday. I believe the date is the 26th. After this, I think that we had a short discussion with the Guard, and I think we will be going to just once a month to see if we can bolster those numbers, but we still want to offer this testing to the community at a public event. We still do have the capabilities of having testing done by one of the contract nurses who is basically doing them by appointment. We have nothing really new for school. Vaccine distribution, we are continuing to do that. We're trying to work on a once-a-week thing. We're still in the process of building the staff. This coming Thursday, we will be getting the second dose into our second cohort. Vaccine availability is still a problem. We don't get much notice on what we can do. The team has developed an online sign-up program. If you go onto our website and follow the COVID-19 things, you can actually sign up to get on the waiting list. It takes you through a few questions. We're trying to cut down the huge number of phone calls that we get with questions. Anyway, we're continuing to work on it. We still have Pfizer Vaccine is what we're still carrying, and of course, any second doses have to be the Pfizer because it has to be the same vaccine as the first doses. but we have heard that perhaps the Moderna might be a little bit more available, so we volunteered to take some Moderna for our next new COVID cohort. Wanted to bring up, we're in the process of doing our community assessment. This is something we're partnered with United Way that takes place every 3 years. And they have now put out a draft on some of the preliminary information. You should have all gotten something that looks like this. Sorry, hang on.
Barb, when you're done with the Compass report, can we go back to vaccines?
Sure. But so that you know that it's in process, if you did not get a copy of the report, yell out and I'll make sure that you get a copy. It's still in the preliminary stages. We did have a meeting very recently, a public meeting. What was it? Tuesday night? Yeah. Last week? I'm sorry. We're kind of busy enough where the time kinds of blend all together. To get some public input on what they thought was important and less important. And we're in the process of putting together that information now, so that I'll have some to give to you at the next board meeting. Okay, vaccines.
I've had a few people call and ask if they can go to, if they work in La Crosse County, can they go there and go to their health department? Or if somebody lives in another county but works in Trempealeau County, can they come here and get vaccines? How's that work?
The answer is yes and yes. The vaccine is considered a federal asset. So because somebody is not living in our county, we can't actually say no. However, I will tell you that we do prioritize people who live or work in Trempealeau County. And I encourage everybody when you're to get on as many vaccine lists as you can. We are currently have a partnership with Gunderson Tri-County here in terms of sharing a waiting list and collecting information together off of our website. We've also been approached by Mayo, and we've got a meeting coming up with Gunderson to discuss the situation with Mayo joining the partnership here. But what the health department is being encouraged by state is to either coordinate and or give vaccines. So the more partners we have, the more vaccine that we can get into arms and the more people that we can protect. Also coming out is the Walgreens has a pharmacy type contract with the state, and they will be getting some vaccine through the state to be able to give. They are supposed to be following all the same rules that we are being told that we have to follow. I'm hearing that doesn't all happen. Not every Walgreens will have vaccine, and I have been told that those that do have it will have a maximum of 100 doses per week. So when people talk to me, I said, sign up for every list you can. Whoever you can get into first, you're that much more protected, or that sooner protected. Did I answer your question? So no, I can't exclude somebody because they don't live or work in Trempealeau County, but I fill the positions first with the priority groups, and then after that, whether or not they live or work in Trempealeau County.
Yeah, I think their concern was that by the time they have to leave their home and then drive to their job and then drive home, they've missed the window when clinics are open back where they're from.
Yeah.
Okay. All right, thank you.
Anything else?
I'm sorry, did anybody not get a copy of the draft of the compass?
I don't think I did, but I will be coming home in about 10 days to 2 weeks, so I'll check in then.
Okay.
I haven't checked my pigeonhole yet,
Okay, I'll put you down for right now. Yeah. It, in fact, Joe, since you're sitting here, if you want to take my copy, I'll print myself another copy.
Whoever's speaking needs to put their mic on.
To repeat
And
what,
Barb,
okay, so I have Beth needing a copy.
if it was mailed out, it could be in my mailbox pile somewhere.
Okay, we'll give you a chance to look before I print it.
Yeah, don't waste the paper.
Beth, I just forwarded it to you. It should be coming into your mailbox now. Your
Oh.
inbox.
Oh, yes, it went bing. All right, I'll study it in my leisure in the next few days.
Thank you, Sally.
Item number 13 would be Carol giving us a review of the agency vouchers and the budget.
So the budget that I have here, it will be addressing 2020 as today at around 2 o'clock I got 2021. So needless to say, it was only 1 month worth of activity. I put all my effort into preparing for the committee and the 2020 budget. So next month I'll have a better handle on the 2021. For the 2020, as I had always said, we are getting a lot of money in, which is a reimbursement of what we spent for the COVID issue. I'd like to call your attention just to some of the expenses that, I mean, that really blew my mind. I'm sure it'll blow yours too. Object number 210, I'll say it out loud here for those that don't have this. The professional services, that is where all of our contract tracers' salaries went, and our interpreters. What am I missing? The contract tracers, the temporary nurses, anything to do with the COVID. That was $147,967, which I knew I was doing a lot of work, but I didn't realize it was that much that went out the door. But again, we're going to get reimbursed for that, which if you look down into the revenue, remember I told you about the special account that was in existence already, but I thought it would be easy to follow. The actual revenue in that account is $312,863.50. So that is reimbursing us for all of our expenses, and we still have money that we're waiting to come, especially Sally, I'll say it again, the FEMA money. I think Paul might have sent that in, if I'm not mistaken, and that was around 60-some thousand that we'll be getting.
Actually, Carol, I think we're going to get more because initially the FEMA funding was, we got reimbursed at 75%, and then we had to come up with, the state came in at 12.5%, and then we had to come up with the other 12.5%. Now FEMA has said they're going to reimburse at 100%, and we are going to be able to continue to put our expenses in. And because of our agreement with Integrity, they will be able to continue to assist us in that. So we are actually going to get 100% back, which is awesome.
Yeah, 2020 was one heck of a year is all I can say. I mean, thank goodness we're all locked up. What would we have done with all this money? That was pretty much, what I wanted to call your attentions to. So when the auditors come in May, there will be some money that, is definitely going to be going, now to the extra flow for the budget. So stay tuned for that. As far as our vouchers for this year, so since our last Board of Health meeting, the agency spent $25,322.06, which is down, and that is because our numbers are down as far as our COVID tracing. So that's a good sign. What do I want to call your attention to? Barb, maybe you'd like to explain on page 3, we have the control solution. This is for the one cool cube, $817 and, yeah, $817. Do you want to talk a little bit what that was?
I don't have the thing in front of me.
It's the cube?
But the vaccine is very, very sensitive to temperature, and we have a what they call a cool cube, which has plates in it that is guaranteed along with its monitors, and it is monitored in it to maintain the temperature that we need to have to keep the vaccine safe. Whoops, I just got waved at and told that I didn't have my mic on, and I am guilty as charged. So in order to maintain the cold chain, the correct temperatures for the vaccine, we have a what we call a cold cube, and it has special inserts that you put in it that are required to keep the vaccine at the temperature that it's supposed to be while we're in the process of using it.
So, all in all, that's just basically what we accomplished this month. So on to the next month. So thank you.
Thank you, Carol. And Barb. Item number 14, setting our next Board of Health meeting for March. I don't have my calendar, but whatever you pick should be fine.
March 16th.
At 6 p.m.?
Yes.
Any objection to that? Then I think we've hit the end of the agenda. This was a longer meeting than normal. Thank you all for hanging in there. I would adjourn at, my computer says 7:48 your time.